Can you take us to the front line of the compassion work? And I know you're in 25 countries, working with millions of children and their families. Talk to me a little bit about how, and you guys are working with the most vulnerable, people in
Yeah.
extreme poverty. And I just want to say how just grateful I am for Compassion's dedicated work in that space. And I'm dreaming that the church would be famous for advocating for those who are most vulnerable. And Jesus was so drawn to children and the poor.
Yes.
And you guys have
Yes.
taken that intersection of two of Christ's passions and made it your mission. I just love that about what you guys do. And then COVID-19 has put extra stress on the most vulnerable. And I just would love to take a minute for you just to help us understand how it's impacted the frontline work, but then also how you've been able to respond, because it's pretty exciting that you've been able to be there and working with the church to help. So just take us to the front lines for a little bit so we can get a picture of that.
Yeah. So, as you said, we work with the most vulnerable, and we have worked with the most vulnerable before COVID, but we have seen how everything about COVID-19 makes the most vulnerable even more vulnerable, and how the reality of not just the pandemic, but the ripple effect of the pandemic is magnified, right? The risk is magnified, the fear, the life and death reality. Because we work with families who have no safety net, right? So for them, their very survival is on the line when a crisis hits. And what that means practically is a lot of the families that we work with are day laborers. So if they're not able to leave their house and go out and earn an income and
Mm,
then come home and put food on the table, it means that their kids aren't able to eat and their kids go to bed hungry. And when this happens for days and weeks on end, the reality of hunger and death related to starvation is real and is imminent for some of them. And so that's a devastating reality for us. Experts and compassion included, as we work with our frontline church partners and keep our ear to the ground, are already predicting cascading effects to this pandemic. We're anticipating hunger could double global hunger by the end of 2020 for the reasons that I just said. We're anticipating a substantial rise in preventable diseases like malaria and measles. And really, again, the economic impact of what started as a health impact could undo at least 10 years of progress towards poverty alleviation efforts. And so we're talking about a global crisis for the world's poor, unlike anything we have seen in
mm,
generations.
yeah. And I wonder if this is the church's moment,
Yeah.
to just go, we care about this. And we're at our best when, you know, when we're pushed, and I
Yeah.
really wanted to have you on to speak to church leaders because of your story and your expertise and wisdom organizationally and personally. But I also wanted to just help build a bridge for church leaders that are saying, hey, I want to help. I want to respond. I want to understand what's going on globally. But I want to use my platform in my congregation to make a difference. And so how can church leaders participate in a meaningful response on behalf
Yeah.
of the least of these around the world?
Yeah. Thanks for asking, Jason. Church leaders and churches in Canada can get involved by partnering with other churches through the Ministry of Compassion so that these pastors and staff and church members can continue to engage in the most critical needs of their neighbors right now. Because these churches know the names and the faces and the needs of their community members and are not only there, but are actively engaging and walking forward in the front lines to prioritize what they have declared is the most critical needs right now, which is the health and stability of kids and families through food, hygiene, and housing security. And so our church partners are doing exactly that. They are delivering food and hygiene kits to ensure that these families not only have the nutritional needs that they want and need for their kids, but actually have carbs to put in their body. They are providing hygiene education, because not dissimilar to what we talk about in Canada, where, we're needing to be reminded of the importance of wearing a mask and of washing your hands and of socially distancing. They spend a lot of time ensuring people understand that one of the most significant things that they can do are these basic hygiene practices. They're in their communities, putting up flyers, ensuring there's clean waters, ensuring there's hand sanitation to support broader efforts. They're helping families make masks who can't afford them. They're supporting them with their rent payments for those who are at risk of evacuation because they can't leave their home to earn money to pay for their rent. And more than any of this, though that's critical, this is the life-saving efforts. They're providing trauma counseling. As you can imagine, the mental health reality for parents and for kids. They're prioritizing child protection, because when trauma goes up, kids are the most vulnerable, and kids get the tail end of that. And more than any of this, they are providing for the ongoing spiritual and emotional needs of these kids and parents by connecting digitally where they have to, or in person, social distance, to pray for them, to remind them of the promises of Jesus, to assure them that they know them and they love them, but that Jesus knows them and loves them even more. They're providing curriculum and digital online small groups to ensure that they stay connected and that they know that they are not alone. And it's been remarkable to hear stories and stories and stories. I've met with almost all of our national directors from our 25 countries, and the message is the same. The church is at work. People are being reminded of the person of Jesus and continuing to grow spiritually while having their practical needs met, and ensuring that their kids don't go to bed hungry, ensuring that families aren't forced to make terrible life and death decisions with their kids at hand, because our local church partners are there and are engaging in these needs proactively.